putting it out there that you all are going to have a great semester, a great year ahead. Just be sure to stay focused, keep your head down, continue to do the activities that are going to lead you to the most success, and just double down on the things that worked in 2021, because 2022 is a new year and you are going to do all the amazing things that you think you're going to do. And I'm just telling you this to manifest it, because you deserve all the great things that are going to come to you this year, whether that's an internship, whether that's a job of your dreams, whether that's a fellowship. Just know that you're going to get this. And this doesn't only relate to public health students, this is public health professionals and public health people more broadly. Just know that everything in life that is going to happen to you this year, you deserve. And all the great things that are going to come out of this year, you deserve. And just continue to put in the effort, put in the focus, and just be diligent in getting to the things that you want to do, whether that's goals, and we're going to talk a little bit more about goals in the next part of it. But I just think it's so important that you all know that you all are doing amazing. If you look at yourself now and look back a year from now, think about all the amazing things that you've done in that 1 year.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this.
Welcome to the Public Health Millennial Career Stories podcast, episode number 88. Hi everyone, Omari Richins here. Thank you all so much for joining me. Be sure to follow me on Instagram if you have not. Be sure to subscribe to this podcast on whatever podcast platform you're listening to, and share with a friend. Be sure to share this episode, share any other episodes you find valuable with a friend. That way it gets out to more people and I'm able to help more people navigate their public health careers, as well as just share more insights with more people. If you'd like to support, you can go to thephmillennial.com/support and see all the ways to support on there. You can also go to buymeacoffee.com/thephmillennial and support there. Okay, this is my first episode that I'm actually recording in 2022. So happy new year to everyone that has been listening to the couple of episodes that have been released in 2022, where I completely forgot to record and say those intro things, saying like happy new year and all those good stuff. So I'm saying it now, but thank you all for joining me and continuing to rock with me on my platform and this podcast. It means the world to me just to know that people listen and appreciate these stories that I'm telling. Today is just going to be an episode with myself, just going to give you all some updates on the Public Health Millennial, as well as I'm going to just talk a little bit about some insights for some public health students, as well as I'm going to go through like setting goals and how you can think about going from simple to smart to dynamic goals and what that really means for you. And I'll talk a little bit about COVID-19, but I know you all are probably very much tired with COVID-19. So I won't talk too much on that. And I would also say that this is the second time I'm recording this. I recorded the entire episode and then I realized that my microphone wasn't connected, so the audio was pretty poor. So anyway, here we go again. And hope you're doing well. As I said before, be sure to subscribe, be sure to like this, be sure to leave a review, especially you Spotify people who were not able to review these episodes before. I know Spotify has allowed you all to review it, so I look forward to those reviews and reading those and seeing the great things that you all have to say. Leave a 5-star, appreciate it. Okay, so some updates about the Public Health Millennial. You know, I've been rocking this podcast, rocking my blog, rocking my Instagram channel, Instagram profile for a while now. And I'm going to be launching the first ever Public Health Millennial book club. The book that we're going to be reading is called Carte Blanche by Harriet A. Washington. And it is going to be $15 if you want to join for one book, and it's going to be $25 if you're going to join for 2 books. If you join for one book club, that means the first book club is going to be February into March, and we're going to meet towards the end of March. And if you're joining for the second book club, that's going to be April into May, and we meet at the end of May. As well as if you want to join both of them, that's $25. If you want to join one of them, that's $15. You might be asking yourself, why did you put a price on this book club? The reason that I put a price on this book club is because I find my time is valuable, and I just want to ensure that people that want to come to the book club are going to get a great experience, as well as they have some a stake in the game. It's like a lot of us, we do free things and people just really don't show up fully. And I think just investing this little amount of money can really help you to be invested and be accountable to the group, and just it ensures that we have more productive conversation, which I look forward to. So if you're interested in joining the book club, the link is in the bio below. I'm going to be limiting it to around 15 people. And I know I've had around 7 people sign up already. So, but if you're interested, the link is in the bio. So join there. And if you join that, you're also going to get access to this Discord group that I'm going to talk about now. I've named it Public Health and Wellness, and it's going to be a Discord group that goes through public health millennial content as well as other content. Just been trying to find ways to really build out community. We'll see if this is something that's sustainable, as well as if it's something that you all enjoy and like. But if you're interested in like just having a space where you can communicate with more public health people in a more intimate way, be sure to join the Discord group. The link is in the description for that as well. And if you join the book club, you're going to get like exclusive channels for the book club in the Discord group, but you'll figure that out once you register for the book club. And then another update that I like to talk about is, if you have not as yet, be sure to subscribe to me on YouTube. The link is also in the description below. And this is important because I'm trying to roll out some more content that's more heavily focused on putting it out on YouTube. I might also upload the audio for the podcast if you're interested in listening to that. So be sure to subscribe to the YouTube channel, the Public Health Millennial, so you can get the updates on those, as well as like if you have ideas for shorter episodes and just things you want me to talk about, feel free to let me know. My email is thephmillennial@gmail.com, and you can just email me there and we could figure that out. But one topic that I think I'm going to be talking about very soon on the YouTube channel is health equity and what that means to me. So be sure to subscribe there to check that out, and all other great content that is going to be there. Lastly, I'm going to be launching the Public Health Millennial Network in February. And this is a network for creators to come together to share different insights in public health and really just elevating public health voices so that we're able to navigate our journeys, our careers, our school paths better, more efficiently, and have those resources to really be successful and get to where we want to be. Because as we all know, we need just guidance to push on and get to that point in our careers where we feel very comfortable and feel very happy with what we have done. So be on the lookout for that. There's going to be a little promo intro that's going to be dropped within the next couple of weeks, but be sure to subscribe to all those other podcasters there as well. And if you'd like to join, please let me know. It is a paid membership program type thing where I'm going to be helping you all out with just content type stuff. So if you're interested, just email me again or DM me at thephmillennial@gmail.com, and we can figure that out. Last but not least, I'd like to thank today's show sponsor, the Public Health Store, where they are uplifting, inspiring, and bringing awareness to public health. Some of you who are watching this on YouTube will see me in my Health Equity Now hoodie, which I really love. I think it's very comfortable. So if you're interested in getting any public health attire, be sure to follow the Public Health Store on Instagram, as well as check out the website, thepublichealthstore.com. And be sure to use the code ThePH Millennial to get 10% off your entire purchase. But dope products. So for public health students, I just wanted to drop some info, some manifestation, some good energy. I don't envy the things that you'll have to go through having to navigate life right now, having to go to school during a pandemic, having to navigate online classes or a hybrid of online and in-person classes where teachers have not really been trained to do this kind of teaching in the past. So it's all a learning experience for everyone, but I'm just putting it out there that you're all going to have a great semester, a great year ahead. Just be sure to stay focused, keep your head down, continue to do the activities that are going to lead you to the most success. and just double down on the things that worked in 2021, because 2022 is a new year and you are going to do all the amazing things that you think you're going to do. And I'm just telling you this to manifest it, because you deserve all the great things that are going to come to you this year, whether that's an internship, whether that's a job of your dreams, whether that's a fellowship. Just know that you're going to get this. And this doesn't only relate to public health students, this is public health professionals and public health people more broadly. Just know that everything in life that is going to happen to you this year, you deserve. And all the great things that are going to come out of this year, you deserve. And just continue to put in the effort, put in the focus, and just be diligent in getting to the things that you want to do, whether that's goals, and we're going to talk a little bit more about goals in the next part of it. But I just think it's so important that you all know that you all are doing amazing. If you look at yourself now and look back a year from now, think about all the amazing things that you've done in that 1 year. And if you're going to take that even further, look back 3 years, look back 5 years. I bet you wouldn't even imagine and envision the person that you are today. And I'm just saying that to say that this next year, these next 3 years, the next 5 years are going to be your next year, your next 3 years, your next 5 year. And I'm saying that for you, that you're going to manifest all the great things that are meant for you in this world. And there are a lot of great things that are meant for you. And we need you to do great work, because public health needs you. Public health needs you a lot. We need you to come, be authentic, be yourself, to show up, to help these communities, because we need to get to the systemic change that we all have been fighting for. And I believe that we can do it. We just need to put our heads down, really collaborate together, figure out the best ways to improve health, to create healthy lifestyles, to change policies, to get systems to change, or to just dismantle some systems and build back new ones that are more equitable and serve us and the community and marginalized communities a lot better than they have in the past. So let's put that out there for my public health people. You're doing amazing. Continue doing amazing. Just keep your head down. We got you. And it's a very thankless job for many of us. So I just would like to extend and say thank you to all the public health heroes out there that have been doing this work that's so important during this pandemic and outside of this pandemic, to keep us healthy, to keep us wholesome, to keep our wellness up. So thank you once again. Okay, so moving on, I just wanted to say to all the students right now, I know that pandemic is burdening you, is making life harder than it has to be, but just know that you're going to get through this, and you're going to become stronger and a better person and more impactful than you ever thought you would be, because you have dealt with this and you're just learning things that a lot of us who have completed public health degrees outside of this pandemic are just not getting to realize and learn and get that real world experience of how things work and how we really need to move forward with health education and everything like that. Because as we all know, health education, health communication, because we know health communication has not been the best in this pandemic, but hopefully we're going to just keep on trotting forward and just continue to learn and iterating as we learn to just do the best that we can. If this is your last semester of your bachelor's program, or your master's of public health program, or your PhD or DRPH program, shout out to you. You've made it so far. You've done such great things. I just want you to know that we appreciate you. We appreciate the hard work that you've put in to come this far. And it's just one more semester. And remember that school is a means to an end. And the end is trying to get a job or that career path that you'd like to get on. So just remember that as you take on this semester, to really apply yourself, not only in the schoolwork that you're doing, in the internships, in the final projects, in the whatever other seminars and professional development things that you're doing, but ensure that you're also applying yourself to build your network, to make connections, and to get into that position that you need. I applied for my job months and months before I graduated my MPH program, and I advocate that you do the same, especially now that the pandemic has put a light on public health. Public health acceptance rates have gone up, so there's more competition in public health, as well as the Great Resignation has added another factor that is going to make it harder for new public health professionals to get out and get into the public health workforce. So just be sure that you're being proactive, be sure that you have those LinkedIn and Google job searches on, be sure that you're connecting in different networks and just building out and connecting with people that can really help you and elevate you and get you to that point in your life where you get that job, or you get that internship, or you get that fellowship that's really going to be that stepping stone to get you to that next point in your life. So I just wanted to say, just stay focused, stay motivated. You got this. Just one more semester, a couple more months. You got this. Okay. Now I'm going to go into setting goals. Some of you might have seen the post that I made on Instagram a couple days, weeks back, I can't remember right now, on setting goals. And the premise for this, there's two things that I want you to focus on when you're thinking about setting goals this year or just in general. Is I want you to focus on what is my vision? What is my overall vision? Whether that's my vision for this year, for the next 5 years, where do I see myself? And really think about what does that person do when you're in 5 years and you live out the vision that you have for yourself. Who are you? Who is that person? And I want you to think about focusing on becoming that person, not so much focusing on the habits that you need to do that, but how do I become that person? Simple example, how do I become that reader? You don't want to just focus on reading a day. Like, you want to get to that point where the goal and the habit of reading a day doesn't matter anymore, because you are a reader. If you miss one day, that's fine, because you're still a reader. You are reading. Whether you miss one day, you pick it back up and you're still reading and you're still building on a habit because you have become a reader. I don't want you to focus on the habit of, okay, I need to read this much, but I want you to have the big picture of, I want to become a reader. What are the things that I have to do to create that lifestyle that I am a reader? And I'm going to go through the categories that I've used to create my goals for the year, as well as going through from simple goals to smart goals to dynamic goals, and how you could think about that. And I'll give you 3 examples from my goals for this year, just to help you think through that. But I definitely think that you all are capable of doing amazing things. Don't cut yourself short. Make sure to put your goals to stretch yourself. Make sure that you put there that work to be intentional to get to where you want to be and become that person that you want to be. Okay, so we all have heard of, well, we know what a simple goal is. A simple goal is just like a goal that we state. So, for example, a goal of reading more, that's a simple goal. How do we take that simple goal and make it a smart goal? So a smart goal, as you all may know, it's something that's specific, measurable, achievable, realistic, and time-bound. So that just adds another dynamic to the goal that makes it more in line with the vision of, how do I get this? What is achievable for me? How can I really break this down? And then a dynamic goal takes that a step further, and it shows you, who are you becoming? Why am I doing this? What is the purpose behind me doing this goal, to really build that into the vision that you have for yourself and who you want to become. And I'll break this down with 3 examples, as I said before. But before I go into those examples, I just want to share the 5 categories that I use to create my goals for this year. And those categories are 1, play, 2, wellness, 3, learning, 4, social impact, and 5, financial freedom. So first, let's break down one of my play goals. And this is very interesting, because some of you might think, oh, this is a silly goal for you to have. But personally, for me, it's been very difficult for me to break out of the mold of either doing work that I'm doing for like my job, or doing work that I'm doing for the Public Health Millennial, or doing work on myself to just continue to develop professionally. So this is actually a very important and intentional goal that I'm doing for myself, to really just take time to disconnect. Okay, so the simple goal here would be relaxation from watching a movie. I just want to get some relaxation. How would I make that a smart goal now? I can make that a smart goal by simply saying, watch 1 movie per month. So that adds that specificity, measurability, achievability, realistic, making it realistic or attainable, as well as timely. So everything is composed in there. But then how do you take that to the next step of having a dynamic goal? And the dynamic goal for this would be watch one movie a month so that I'm able to disconnect and enjoy something without having any need for outside growth. So how do you make this a dynamic goal? The dynamic goal here would be watch one movie a month so that I'm able to disconnect and enjoy something without having to think about anything professionally. And when I think about this, I want to become the person that is able to disconnect and enjoy themselves outside of just the work that they are doing. And this is important for me because I've had a hard time building in that play aspect, at least particularly with movies and things that I used to like before the pandemic. I definitely still do play around, like playing football or soccer, as you call it in the USA. But this is an intentional goal for me to really take my mind away from doing work and just relaxing and just disconnecting. And I want to become the person that is able to relax and disconnect. And I want to have that as part of my persona going forward. So the next category that I'm going to cover a goal from is from learning. And the simple goal here would be the goal of reading more. How do I make this a SMART goal? I want to read 2 books a month. And then how do I take this SMART goal to make it a dynamic goal and encompass my vision and my purpose for a bigger, I don't even know the word, but a bigger vision for why this goal is important to me? It is read 2 books so that I can learn novel ideas and implement them to have a greater impact. And when I rephrase this and I think about this, what do I want to become? I want to become someone that is impactful by learning and sharing those ideas that I'm learning. And that's the person that I want to become. And how am I doing that? I'm doing that by reading 2 books a day. I mean, 2 books a month. 2 books a day would be crazy. 2 books a month is what I'm on right now. And I think that that's an achievable goal for myself, as well as it just fits into my vision of continuing to want to share content on the Public Health Millennial, as well as just growing myself and just developing more, And I think we need to just continue to develop. But at that same point in time, that's why I have that play goal, because I don't want to just continue to develop and not have time to play and disconnecting and relaxing and just refreshing my mind and refreshing my perspectives, because I do think that is probably just as important as this goal of reading more for myself. And the last one that I wanted to talk about is wellness. And my goal on wellness, simple goal, is the goal of being more active. And if we take that to the SMART level, it's going to be active 6 days a week through the gym, running, football, hikes, yoga, or other activities. And how do I make this dynamic, you ask? Be active 6 days a week through various activities to live a healthy and active lifestyle to increase my happiness and productivity. So what am I becoming? I'm trying to become a more productive, more happy person by being active. And I think I don't have to overstate or understate the importance of having an active lifestyle and how that plays into the importance of our overall well-being, because that's a huge thing that I'm just trying to build into my life, that I'm living a healthy life, that I'm embodying everything that we want for public health, that we need for our communities. How can I implement those things into myself? How can I become the person that is more happy, that is more productive through a healthy lifestyle? And I just want you all to focus on that becoming part. And because I think it just gives you a bigger idea for yourself and just gives you a framework to think through, okay, how do I get to becoming that person that I'm trying to be, and more so less focusing on the habits. But the habits and the activities are hugely, hugely important in order to become that person, and building the habits and the repetition and just building these things, these goals, these activities into your life are just a way to become the person that you want to become. And while we're talking about goals, I just wanted to also share that there is the minimum viable activity that you want to set for your goal. So let's go back to my reading goal. And in order to achieve this goal of reading 2 books a month, what's the minimum viable activity that I have to do here? Currently, I'm reading a minimum of 10 pages a day. And that's a minimum that I have to hit for myself. And what I've come to know over these last 24 days that I've been reading every day is that some days I will read begrudgingly, I will read 10 pages and then I'm done for the day because I'm like, I don't want to do any more of that. But then other days, I'm like, okay, I hit my 10 page goal. Let me do some more. And I think that's how we should think about it. What is this minimum, the minimum goal or the minimum activity that we need to achieve in order to hit that larger goal that we have for ourselves, that dynamic goal that helps us become the person that we want to become. So I just want you all to think about that. What is that minimum viable activity that you have to do, whether that's daily, weekly, monthly, to ensure that you're hitting your goals and achieving the success that you deserve and that you need. Okay, and then lastly, I said I'll talk a little bit about COVID-19. I'm definitely not going to talk a lot about it. As some of you may have known, I recently tested positive for COVID-19, I think last week, Wednesday. I got symptoms for the first time on Tuesday. Those symptoms were primarily me feeling sore and a headache on the first day. And then from there transitioned more into a lot of coughing, a lot of dry coughing and sneezing and congestion in my head. And then that dry coughing went more to like a wet cough with more mucus and things like that. And I was just very congested in my head. And it just made me feel very foggy in my brain. Thankfully, I am feeling a lot better. Thankfully, I was vaccinated and therefore it's doing its job of protecting me. And thankfully, I got tested to know that I was positive and I was able to stay home and isolate away from people and not spread this to any more people. And while I say that, there's definitely a lot of privilege in me being able to say I tested positive and I'm able to continue to do my work. I'm able to continue to isolate in my house, because that is a privileged situation that a lot of people are not able to live out. A lot of people probably are scared of getting tested because they know if they get tested and they test positive, they're going to have this mental thing in their mind where they're like, okay, I'm positive, but if I don't go into work today, I'm not going to be able to put food on the table for my family next week. And therefore, I accept my privilege and I understand that I'm privileged in a lot of ways with COVID-19 to be able to say I've gotten COVID-19 and I'm fine in the sense that I can work still, I can stay home and isolate. I have the resources to really take care of myself in isolation and things like that. And that is not the case for everyone. So I just want to put that out there for everyone that is able to isolate, that is able to work from home, that is able to do school from home. Just remember that that isn't the case for everyone. So just really, really empathize with people to ensure that you're thinking about them and you're thinking about yourself, because it's been a tough year for a lot of us. Tough 2 years for a lot of us. And I just think that empathy is one of the biggest lessons and skills that I'm trying to develop. And I think that it would serve you well, especially in public health, to really know that you are building the skill of empathy. And I also wanted to highlight some other privileges that we have living in the US or other developed nations. The obvious privilege is that we were able to get access to the COVID-19 vaccines before a lot of other nations. And with that being said, we still have the infrastructure for a lot of us to do a lot of the work that we're doing from home, when a lot of people in a lot less developed nations don't have that privilege of being able to get vaccinated. So they're home, not able to work. And that is really creating a lot of economic distress for people, for communities. So I just want us to always think about how is this affecting me in my community? How is it affecting me in my county? Then you could go into the state level, then you could go into the national level, then always think about it globally, because as we can see from this pandemic, it's a very global pandemic. The pandemic has affected us worldwide, and we need to continue to fight and get the equity that we need to ensure that the pandemic is as short as it can be. We know that there's been a lot of missteps in a lot of places right now, but I think that we just need to continue to know this and continue to do your part to advocate for people to get vaccinated, to wear a mask, to stay home if you can and isolate when you're feeling sick, or get tested regularly. If you're going to big functions, make sure that you're getting tested, make sure that you're knowing the status of other people that you're around and things like that, because it's coming to a point where the pandemic is less so affecting people that are vaccinated, that are healthy, and it's more so becoming an issue of those vulnerable populations, which it always was, but more so we can see that, especially as people are getting out in the community more and just going back to a more normal way of living. We're just seeing that cases have skyrocketed, and this is due in part to the vacation, it being colder, Omicron spreading more rapidly than other variants. But I also wanted to highlight the positive side of Omicron and how it has helped us. And I say help, quote unquote, because it definitely is still killing people. So let's keep that in mind. But for the majority of people that do get Omicron, you are not going to die. You are going to have mild symptoms, especially if you're vaccinated. So it's good in the sense that it's spreading a lot and it's preventing people from getting more deadly variants like the Delta variant. So it has a lower mortality than the Delta variant did. Therefore, as we have seen it spread over the last couple of weeks, and thankfully the curve is finally starting to go down. But we have to just understand that we still have to take the measures to ensure that it's not spreading too much, because the issue with it spreading too much is that it gets those vulnerable populations, which then gets to overloading our healthcare systems, which have been overburdened and overstressed, as well as we all know that the pandemic has made a lot of other services for like cancer and all these other health issues that people deal with a lot harder to access. So we need to understand that we need to keep the cases low so that there isn't a new variant that comes around, as well as that we're not exacerbating and hitting the hospital systems, as well as we just need to understand that this is a global game and we need to ensure that people are getting vaccinated around the world. And I just wanted to highlight that currently the world has 62% of people around the world have received their first dose of the vaccine. It is around 53% that have received 2 doses of the vaccine, and then 12% around the world has received their booster shot. And we just need to continue to get vaccines to people that need them, people that need to access them, so that we're able to get back to some sort of normalcy. What I do think is going to be, or would be cool to have right now, in addition to like just regular COVID test, would be something that is similar to a blood alcohol level tester. So the thing that you blow into, breathalyzer is the correct word. The thing that you blow into and it tells you your blood alcohol level. If we could get something like that that can tell you how infectious you are, I think that would be a huge help, because you test positive for COVID-19 and you could test positive after you get COVID-19 for a very long time. I know I've known a couple of people personally that have tested positive 13 days after their first exposure and infection to COVID-19. But I think the real thing that we have to think about here is like, what is the infectious rate? Like, are you really that infectious even though you're testing positive? And that's also the issue with the tests that we have now. Like, we don't know which test to use for which circumstances, and then which test do we use? Is it a PCR? Is it an antigen? Is it an antibody test? And all these tests work in different ways to recognize the virus in a different way. And therefore, we really need to have some sort of a semblance of guidelines to know which test is most effective for which stage of COVID-19 you are, which variant you have, and other things like that. I just also want to highlight and go back to say that like Omicron is an issue in the sense that it's evading our immunity. And in that sense, we need to ensure that we are getting vaccinated, that we are taking the steps to protect ourselves and our communities, and especially those that are vulnerable, because We don't want this to get out of hand. We don't want a new variant to come out that is more deadly, that is evading all the vaccines that we have been able to administer to people around the world. And therefore, I think it's a very timely matter to get these vaccines out to people, to ensure that we're getting people vaccinated, we're getting them as safe as possible so that hospitalization rates and death rates go down and COVID-19 becomes more endemic to a lot of places, and it would be treated more like a flu. So there's just a lot of dynamics that are going on here. But I think as we continue to get more natural immunity as well as more vaccination immunity, we're going to see this become more endemic. When that will be, I don't know. I'm hoping like within the next year or so, it becomes less of a concern. We might have to continue to get boosters every year. It might be similar to the flu shots. Hopefully we have a higher uptake of COVID-19 vaccine shots every year than flu shots, because I want to say the flu shots around 50% a year. But at the same point in time, the vaccines for COVID-19 have been a lot more efficacious than the flu vaccine, which is great. And we just need to continue to do what we're doing now, continuing to advocate for more vaccines, more vaccinations, more tests, more access to at-home tests, and figuring out which tests are best for what circumstances, not experiences. So just thinking through those things. For me, I'm still going to be wearing a mask in a lot of occasions, probably not going to be going to a lot of crowded events unless they ask for people to show that they're vaccinated. And then still, I'm going to be wearing my mask. I'm probably going to be a lot more cautious. So I just wanted to put that out there. I know that might have been a lot of jumbled thoughts that I've been having around the pandemic, but I just think that we as public health professionals need to continue to educate and do the things that we're doing, not only around the pandemic, but around just positive health behaviors, as well as trying to force the systems to change so that the issues that we did see during the pandemic that have been exacerbated in the communities that are most vulnerable, most marginalized, least resourced, are able to get the resources, get the funding, get the education, get the built infrastructure and the structural systems changed to really support them in equitable ways. So I just wanted to put that out there. Okay, this is the second time I recorded this. And I just want to thank you all for continuing to rock with me, continuing to listen to my content, continuing to be inspired and motivated by my content. I'm very highly motivated by you all and all the great work that you all do and are going to be doing. So just continue to do that, continue to persevere and do the work that you need. Stay safe, do the things that you can. Don't stress out too much. Empathize with others, and we will get out of this and we'll become stronger because of this. And hopefully we get the investment in public health that is needed to really get the changes that we need to improve the health and well-being of all populations, but especially the ones that have been left behind and left out of the process. So thank you all for listening today. Like I said earlier, this episode is sponsored by the Public Health Store, where they are working to uplift, inspire, and bring awareness to public health through apparel. If you're interested, be sure to check them out on Instagram at the Public Health Store. Be sure to check out the website, thepublichealthstore.com. You can use my code, the MPH Millennial, to get a 10% discount, and you can rock a dope Health Equity Now hoodie like what I'm wearing now. And I just appreciate you all a lot, and I look forward to sharing more insights, helping you all navigate your careers, and just continuing to do this because I enjoy it, and it brings me a lot of satisfaction that I'm able to impact people and help them along their public health careers. So without further ado, just be sure that you subscribe to this, that you leave a review, that you share with a friend, that you follow me on Instagram if you have not as yet. Greatly appreciate it, and look forward to bringing you all great content. Public Health Millennial out.